So welcome to session 2B. My name's Amanda Batty. I'm a Workforce Transformation Manager at Health Education England, so you're very welcome to join us for this session. Leanne and Sally will introduce themselves, but we've now got the session on occupational therapy and physiotherapy placement expansion. So very pleased to do that. I'll keep checking the chat box for you ladies once you've presented, and then let's see how the conversation goes. So welcome everyone. I'll let everybody in.
Brilliant, thank you, Amanda. Sally, are you happy if I share the slides on my screen?
Yeah, go for it.
Just bring them up. So I'm hoping that everybody can see those now. Are they working?
Yeah.
Brill. So thank you very much for having us today, guys. My name's Leanne Horsley. I do two roles. So I am one of the CPEP leads and one of the AHP faculty leads for the AHP faculty in Nottingham and Nottinghamshire. And I also work for Sherwood Forest Hospitals. I am the physiotherapy placement coordinator there. Sally, do you want to introduce yourself?
Yeah, so I'm Sally Knapp. I'm a speech and language therapist by background. I'm work at the AHP faculty in the CPEP project with Leanne. I'm also the AHP lead for practice learning and education at Notts Healthcare Trust as well.
And I just want to also mention Nancy Manners and Suzanne Abington, who I know are logged into this call, but I'm not certain they're in this breakout session, because along our AHP faculty journey, all four of us have been involved at some point, and a lot of this work is kind of down to their hard work and effort as well. So just thank you to them from the very beginning. So what we wanted to do today is tell you about our CPEP journey. So our clinical placement expansion projects were funded from Health Education England CPEP money. And this presentation really is just a summary of the things that we've been up to, the challenges that we've had, and it's quite an honest explanation of the journey that we've been on, really. So did see to make sense to try and tell you where we started from and where we're up to. So we put this slide together. This starts in July 2022, but actually our AHP faculty was born in February and March 2022. We were one of the original AHP faculty testbed sites. So we started with high hopes in March, and of course along came COVID. And kind of, as it did for all of the faculty testbeds, just disrupted those plans a little bit. As a faculty, we decided to pause our project, mainly because some of our faculty staff, so myself, were redeployed. I'm an ICU physio by background, so it meant that we were able to pick that back up, and that was timed quite nicely with the opportunity to bid for CPEP money. We were really pleased that one of our local universities, so the University of Nottingham, approached us and said, let's put a joint bid in. We're really going to need to look at how we support physiotherapy placements and occupational therapy placements. So we submitted a bid in July, and we were thrilled to discover that we were awarded some funding to start some clinical placement expansion projects. And we were asked by Health Education England at that point to try and generate 13 additional occupational therapy placements and 13 additional physiotherapy placements. So what we did is we set to work straight away, and this was August 2020. So we developed a really pragmatic approach. We'd got physiotherapy placements that were starting really quickly. It was around the time when there was lots of information coming out about innovation for placements, running remote placements, project-based placements, leadership placements, and these were all really new to the profession. So what we wanted to do is put together some engagement events where we almost gave our clinical educators the permission to run those placements and to organise those placements, because understandably there was a little bit of reluctance from our clinical educators that were working in clinical practice. I'll tell you a little bit more about exactly what we did in the next slide, but we successfully ran 15 events and we collaborated with 3 of our HEIs in order to do that. We then naively, as we were running these sessions, we really hoped that whatever worked for physiotherapy, we would almost be able to pick up and drop onto occupational therapy. And I giggle a little bit looking back at that, because that's not how the allied health professions work, and I think that was a learning curve for all of us, really. And what we realised as we were going through is that the occupational therapy challenges weren't exactly the same as the physiotherapy challenges, and so what we did is we took a bit of a back step in January, and we sat in a lot of HEI meetings around placements, and we just did an awful lot of listening to the conversations that were going on. They were trying to do great work about educator training, placement expansion, removing some of the barriers. And we just were listening to all of those events and almost getting a real bird's eye view of what the challenges were. Sally will explain a little bit more about what exactly we did for occupational therapists, but we did some engagement events and some focus groups for those. In March 2020, we were asked to review our placement numbers by Health Education England, and what we found is we generated across the ICS an additional 39 physiotherapy placements and 23 occupational therapy placements. So, of course, we've met those KPIs that were set for us at the beginning. We were really lucky, and we have been able to start a third project, which is looking at some AHP diversity work. We have only started that at the very beginning of this month, so we've recruited some staff into that position who started on the 1st of April, and they're currently doing some scoping work around some of the numbers for the different professions and what the diversity is like in those different professions. And once we've collated some of that data, then we'll have a bit more of an idea of where that project's going to go. So to tell you a little bit more about the physiotherapy session specifically, we ran what was initially actually planned to be 12 events, but we ended up running 15 because one of our local universities added in 3 extra events at the last minute. These were really wonderful because these brought together all of our HEIs. So Sheffield Hallam University, the University of Nottingham and the University of Lincoln. These unis all provide physiotherapy students to the ICS footprint. So it's really important to our clinical educators that they can see that these guys are working collaboratively, because it's quite confusing and quite stressful for the clinical educators if they feel that they don't understand how the different unis work together. The aim of these sessions was really to recover that clinical placement activity. And remember that this was following that enforced pause in clinical placements that we had last summer. What this poster did, this is what we sent out. This poster was really good because all of these links here were live. So for example, these pre-session resources on the right hand side, you could click a link and you could access Sheffield Hallam's, the same for Nottingham, the University of Nottingham, the same for the University of Lincoln. So it just removed barriers for the clinical educators. They could find everything they need in one space. They also had the list of dates all in one place, and they also had all the booking links all in one place. So it made it really simple for our educators to get booked on. These were also brilliant because these actually replaced face-to-face sessions. So what that meant is we could, more and more of our educators could actually attend than would be able to normally. And that meant that we were able to get large numbers of people attending at relatively short notice as well. I'm just going to hand over to Sally so she can tell you guys about the occupational therapy events that we ran.
Thanks, Leanne. Yeah, as Leanne's already said, we needed to take a different approach really with occupational therapy, and we realised that quite early on after our conversations with the 3 universities, which are Derby, Lincoln and Sheffield Hallam. And we did do a lot of listening, as she said, and actually what we realised that were a lot of the barriers and the things that were perhaps limiting placement provision and placement innovation weren't just in relation to COVID. There were lots of other issues that we were uncovering really that were situated in different places within the system. So one of the things we decided was a good place to start, having had a lot of those sort of conversations with the HEIs, was to look at some focus groups. And we structured those so that there were 4 different focus groups, and they looked at physical and mental health and acute and community working. So people were invited to book onto those and to give their experiences, and there was a sort of the usual kind of topic guide to take through that, and really very rich data gathered through that. That helped us to really understand, as a physio and SLT, we really wanted to understand from occupational therapists themselves what their experiences were, and what the barriers and the enablers were to offering placements in a time of a pandemic, but also just generally. We then felt that really what we needed was not so much a sort of nuts and bolts sort of practical session, but more of a session to try and sort of inspire, to really help people to see placements a bit differently, to share some of the feedback from the focus groups, but to also share best practice. So we created 3 events, 3 sort of identical events that we ran, and we also made some digital clips that we used, where we got different OTs talking from social care, from within our NHS providers within the ICS. We had a nice example from an OT student who'd gone on to qualify and then get a job in the time of COVID in an organisation that she'd had a placement on. So a really nice sort of closing the loop. So we recorded those and shared those during the session. And we also had the 3 universities on the session as well. So there was a real sort of practical opportunity at the end to ask those sort of specific questions. We also created some quick reference documents that would really help people to see what the placement dates for the 3 universities were, the educator training, and to just sort of take away some of those practical barriers as well, where people have got to do a lot of work to try and set something up. So there was a sense really of sort of supporting innovation, including sort of remote working, blended placements, different sort of supervision models, but also just getting people across the line in perhaps unused capacity, and really sort of making that seem like a real sort of option for people, so that they could actually start to offer placements. Next slide, please, Leanne. We'll come back at the end, last slide, I think, a couple of slides, just to sort of talk through some of the other things we learned from that. But that was the sort of gist of the OT events. We had really good attendance. We had between 30-40 people on each event. Lots of discussion. It was a really sort of positive way of supporting people, and I think providing some of those ramps to get people across the line with offering placements again. And then just to touch briefly on this sort of final part of the funding that we've had for our CPEP money. So as Leanne said, this post is a new one. We've just appointed to it last month, and the 2 leads have just started working together. And the idea for this is that we scope out how we can nurture and grow a more diverse undergraduate workforce. So responding to some of the national data around diversity within AHP professions, also acknowledging the work of the Repair Project, which we know students drop out of courses. And we also know that there's a real sort of issue perhaps in terms of how we attract people into AHP professions across a really sort of diverse group of people, really sort of looking at the access to those courses. So the idea is that this project will really scope out some of those sort of early career offers, how we attract people in the first place to think about AHP careers, and then how we actually support our students when they're on placement with us, what are the cultures that they're coming into like. And it will be a project that sort of gets to grips with some of the sort of the numbers and the details and scopes that out, and perhaps poses some more questions and challenges for us going forward. And that's again working across the ICS, so across all our health and social care partners within Nottinghamshire. So we're excited about that, and it's running for 6 months, starting this month. Thanks, Leanne.
Thank you, Sally. So from this work, we have got some key reflections, and I think these are all from an ICS perspective and around kind of ICS working. But I think one of the big things is to recognise that the data for AHP placements is not always robust, and really honestly speaking, that's if it's there. So a local agreement for trying to track that AHP placement data really is key. So, I mean, it's quite tricky for us when we first put together our placement expansion numbers. We didn't have data from all 4 of our NHS organisations within our ICS. So we're still not sure, as we're sitting here today, how many placements we are offering for AHPs across our footprint, and that's something that we need to work with Health Education England on. I know there is a data dashboard offer coming at some point. The second reflection we had really from this work is that placement innovation is important. It's super important, and I have had 2 students on a virtual leadership placement with me, so you know, those opportunities are going towards placement capacity and additional placement capacity. However, the biggest push to our additional placement numbers was tapping into an untapped capacity. So finding those teams that have historically not had students with them for a long time, really working with them so that they rebuild that confidence and are able to offer placements again. And the majority of our additional placements have come from looking at untapped capacity rather than focusing lots on placement innovation. From our perspective, a true ICS approach is really difficult to achieve. It's not truly still the case for us. That's not helped by some challenges around the technology for combined system working, but it's, you know, I kind of don't want to put our numbers out there and say that this has been a true beautiful ICS approach. We still do have areas that we need to work on that. It's really important to build sustainability into these projects. So although we have increased our placement numbers for both the professions, I do know that the University of Nottingham are still really desperately looking for physiotherapy placements, for placements that start in a matter of weeks. So, you know, it hasn't solved their problems. It needs to be something that we are able to build into the future and kind of maintain those improvements. Sally talked to you about before and said that we've realised that we can't lift our improvements and put them onto another profession, and it's really important that we don't bundle together the allied health professions because they are so different, and if you do bundle them together you will miss the key differences between them. And the last reflection from us is just the technological challenges of system working. So just things like storing resources. So in our initial CPEP bid, we wanted to put together a toolkit for educators where they could go if they wanted to offer an innovative placement, but just the logistics of finding somewhere on the internet to store that has been really challenging. Over to you, Sally.
So just very quickly, a final slide, just what we want to work on next, really. So the building of the relationships with our HEIs is really key, and there are some things I think that, well, if we could get those to work together better, then we would be solving some of the issues that our practice educators face. So things like wasting placement capacity because placements aren't taken up, but they're turned down at the last minute, so they can't be passed on to another university. The way placements are timetabled across different universities so that they overlap, and that doesn't facilitate placement numbers. Perhaps paperwork isn't shared, or that's quite a challenge for people looking at different sets of paperwork. And also things like accreditation processes, which we've seen particularly as an obstacle within our OT groups. Also, really, that robust methods of communication between universities and clinicians, and we know the role of placement coordinator is really important, but we also know it's really patchy, and we can't rely on that if we don't have those everywhere. And we need to think of other ways of developing placement champions and really sort of trying to look at the way different providers do that, and accept that we might need different ways of really sort of promoting that communication so we get best sort of placement outcomes. Really sort of looking at, I think what we've really realised as well is that when you want to start innovating with placements, what people do need, some people will just go away and innovate and do new placement models. Other people will need support, really bespoke sort of tailored workshop type support to get those placements across the line if they're different. And I think that's probably going to be one of our recommendations really going forward, as are all of these, is that actually sometimes people need that next stage of how can we build a timetable, how can we actually look at how that works, how can we get the details. And then finally, the big question about placement allocation, which comes up all the time and doesn't really go away, but does obviously need addressing. Very different again across AHPs how that works. But when we're looking at this untapped capacity, how do we really get that message across? I've just come out of the Lincolnshire session where they were talking about tough love and just trying to actually get the message across in a supportive way, but that we are here to train and develop the professionals of the future, and we need to all be able to step up and take students and really get that message across in a positive way. Thank you.
That is our last slide, and I know we have gone to time.
I'm going to say, you got questions because we've got a minute left.
I'd be more than happy for them to be sent over as well if people wanted to.
That is exactly what I was going to suggest. Absolutely fantastic presentation of and innovation that you've just started to touch on, really. So I think everybody would agree that there's lots of work you've done, and you're even excited about even more work that you're going to be able to do as a faculty. So brilliant. Thank you for that. As I've said, we've got 1 minute left, so if anybody has got any burning questions that they want to ask now, we could take at least a couple, because I know we've got a little bit of a 5-minute gap before the next one, the next session. Happy to do that. If not, then please can you put your question in the chat box, and then we'll pick that up and we'll get Sally and Leanne to answer that, if that's okay with everybody. But excellent, so thank you both.